An investigation of innate immune mechanisms, chronic inflammation, and type 2 diabetes by Michelle Outing, Antonique Darling, Brichet Barrows, and Petra Davis.
The inflammatory response is a local tissue reaction to injury or other trauma. It can be characterized by pain, heat, redness, or swelling. This response includes changes in blood flow patterns, an influx of phagocytic or other immune cells, the removal of foreign antigens, and the healing of damaged tissue. The role of the inflammatory response is to combat infection and tissue injury. There are two types of inflammation: acute inflammation, which is the short-term response of the body to adverse stimuli, or chronic inflammation, which is an inflammatory reaction that lasts for months or years. The aim of chronic inflammation is to limit and remove the agent which cannot be removed by the acute inflammation response. Inflammation is a common pathogenesis of many chronic diseases, such as cardiovascular and bowel diseases, diabetes, arthritis, and cancer. Different types of inflammation share a common mechanism, which can be summarized as cell surface pattern receptors, which recognize the harmful stimuli, which then activates the inflammatory pathways. Inflammatory markers are then released, and once they are released, inflammatory cells are then recruited to the site. When there is a local infection, tissue damage, or exposure to some harmful substance, sentinel cells that reside in the epithelial layer, such as macrophages, mast cells, dendritic cells, monocytes, and neutrophils, recognize pathogen invasion or cell damage with pattern recognition receptors. Classes of these pattern recognition receptors include toll-like receptors, C-type lectin receptors, RLR receptors, and NOD-like receptors. These receptors detect PAMPs, pathogen-associated molecular patterns, or DAMPs, damage-associated molecular patterns released from injured cells. The recruitment of leukocytes from the blood into the site of infection or damage is a critical component in the inflammatory response. These factors act on the vascular endothelium of the local blood vessels, which increases vasodilation and vascular permeability, and the said epithelium is inflamed or activated. Pattern recognition receptor signaling activates the resident macrophages, dendritic cells, and mast cells to release pro-inflammatory cytokines, which are interleukin 1, interleukin 6, and tumor necrosis factor. And they mediate inflammation through interactions with the toll-like receptors. At the sites of tissue injury, damaged epithelial and endothelial cells release factors that trigger the inflammatory cascade. The first cells attracted to the site of injury are neutrophils, followed by monocytes, lymphocytes, and mast cells. Neutrophils are the key mediators of the inflammatory response and program antigen-presenting cells to activate T cells and release localized factors which attract monocytes and dendritic cells. Monocytes then differentiate into macrophages and dendritic cells and are recruited via chemotaxis into the damaged tissues. Macrophages during inflammation present antigens, undergo phagocytosis, and modulate the immune response by producing cytokines and growth factors. Lastly, the activated mast cell releases a variety of inflammatory mediators, which include cytokines, chemokines, histamine, proteases, and prostaglandins.
What is the relationship between chronic inflammation and type 2 diabetes? Inflammation is a natural response of the body to injury or infection, and it serves to aid in healing damaged tissues and combat harmful pathogens. However, when inflammation persists over a prolonged period, it can lead to harm to healthy organs and tissues, which results in long-term health conditions such as type 2 diabetes. As previously stated, with type 2 diabetes, it is believed that chronic inflammation contributes to insulin resistance. This occurs when the body cells becomes less responsive to insulin, which is the hormone that regulates blood sugar levels. High blood sugar levels due to insulin resistance can cause damage to organs and blood vessels over time. Studies have shown that chronic inflammation is connected to an increased likelihood of developing type 2 diabetes. Specifically, inflammation in adipose tissues or fat tissues is considered a primary factor in the development of insulin resistance and type 2 diabetes. Adipose tissues, which are known as an active endocrine organ, produce different types of hormones and inflammatory cytokines that can impact insulin sensitivity. Some examples of factors that can cause chronic inflammation include obesity, having an inactive lifestyle, poor diet, and also smoking. Adopting lifestyles such as losing weight, exercising regularly, maintaining a healthy diet, and quitting smoking may help to reduce chronic inflammation and lower the risk of developing type 2 diabetes.
The relevance of inflammation to the innate immune system. Inflammation is the immune system's response to harmful stimuli such as pathogens, damaged cells, toxic compounds, or eradication, and acts by removing injurious stimuli and initiating the healing process. Inflammation is therefore a defense mechanism that is vital to health. An important component of the innate immune response is inflammation, which is brought on by microbial infection and tissue injury. Appropriate inflammatory responses coordinate long-lasting adaptive immunity against certain pathogens and offer broad-spectrum defense against infection. Microbes are detected by pattern recognition receptors, or PRRs, expressed in innate immune cells such as macrophages. The detection of microbes by the PRRs rapidly activates signaling cascades and generates inflammatory responses. Using a combination of cellular and molecular attacks, the innate immune system identifies the nature of a pathogen and responds with inflammation, phagocytosis, cytokine release, destruction by NK cells, and/or a complement system. Inflammation is triggered when innate immune cells detect infection or tissue injury. When triggered by signals like damage-associated molecular patterns, inflammatory cytokines, or complement factors, the innate immune system is made to defend and protect the organism. At the site of infection or damage, activated innate immune cells such as dendritic cells, macrophages, and neutrophils phagocyte foreign substances and host debris while simultaneously secreting cytokines that influence the slower lymphocyte-mediated innate immune response.
Mechanisms involved in chronic inflammation-induced type 2 diabetes. There are several mechanisms linked to chronic inflammation-induced type 2 diabetes. They are hypoxia, the NF-kappa beta and JNK pathway, cell death, the IL-1 system as a sensor of metabolic stress, IL-6 and insulin resistance, chemokines, adipokines. The NF-kappa beta pathway and JNK activities have been found to be increased in skeletal muscles of patients with type 2 diabetes. The pathway are thus activated in multiple tissues in obesity and type 2 diabetes and have central roles in promoting tissue inflammations. Hypoxia can be defined as a relative deficiency in the amount of oxygen reaching the tissues. Cell death. Adipocyte expansion beyond oxygen and nutrient requirement also seems to lead to adipocyte cell death. Islet inflammation is an early event in the development of type 2 diabetes. The IL-1 system is a sensor of metabolic stress, and hyperglycemia induces apoptosis in cells. IL-1 and FAS contribute to both the impairment of cell secretory function and apoptosis. Another factor promoting islet inflammation in type 2 diabetes is a defect in an anti-inflammatory mechanism. IL-6 and insulin resistance are controversial. Increased levels of IL-6 and CRP are associated with obesity and predict the incidence of type 2 diabetes in predisposed individuals. Adipokines such as leptin and adiponectin have potential immunomodulatory effects, but leptin may not have a particularly important role in obesity-induced inflammation and may contribute to inflammation in type 2 diabetes, including direct sensing of excess nutrients and so forth. Chemokine, they are a crucial immune mediator. The precise function of the various chemokines remains to be clarified. However, they have a crucial role in tissue infiltration by immune cells in type 2 diabetes.